Endometriosis is a big problem in patients who are like undergoing infertility cycles, the fertility treatment. They are also present in adolescent girls, but it has not been addressed, or in females who are already become pregnant, or in females who have had miscarriages. So endometriosis is a problem of reproductive age group in females basically, and this needs to be addressed. In endometriosis, what happens? You first start having endometriotic cysts, and which grows subsequently, and then it can be graded into grade 1, 2, 3 or 4 endometriosis. If you are having grade 3 or grade 4 endometriosis, it really becomes severe and it becomes difficult for you to conceive on your own. In grade 1 endometriosis, many patients are there who have become pregnant and they don't come to know also that they are having endometriosis, or in later their life they come to know about it when they have a scan incidentally or they have got some symptoms. Because endometriosis is a silent disease. It is like a termite that has gone inside your body and it has taken hold over your ovaries. In that, it starts eating up your ovaries. So it is very important for us to know what are the symptoms of endometriosis. Basically, the symptoms come very later on when the disease has already set in. You start having pain during your periods, pain during intercourse, pain during urinating, pain during defecating. This is the commonest symptom of endometriosis. And for this, it is not caught on the ultrasound also. Basically, first and foremost, we need to do an MRI or a laparoscopy to diagnose an endometriosis. So if the endometriosis has set and you don't have a baby, then basically you need to go for an ovarian aging as soon as possible. And before surgery, if you are planning a laparoscopic surgery, you should go for your egg freezing. Because whenever we are doing surgery for endometriosis, whenever we are burning the tissues or we are taking out the cyst, definitely some part of the ovarian tissue is also coming out, and this ovarian tissue is responsible for making eggs. So if the ovarian tissue comes out in large heaps, in large chips, then ultimately you are left with very less AMH, and that affects your fertility subsequently. So for all patients who are undergoing surgery for endometriosis removal, they should go for, first they should go for their egg freezing, then only they should go for these surgeries. Secondly, whenever we are planning to implant, we are planning to do a embryo transfer in a patient with endometriosis, we should always weigh our risk of a frozen cycle vis-a-vis fresh cycle. And we do use frozen cycle in patient with endometriosis because there are many immunological things that are also responsible for low implantation in patients of endometriosis. So we prefer doing frozen cycles so that we have a more better success rate as compared to fresh cycle in patients of endometriosis. Or we can plan a surgery also maybe before your embryo transfer. Thirdly, a patient who has become pregnant also and is endometriotic, they also run a risk of having a miscarriage during their pregnancy. So the patients have to be always on their tenterhooks, like they have to keep on, like they have to be very much like they know what is the problem, and they have to discuss it with their obstetrician whenever they are pregnant also, if they are suffering from endometriosis. Because endometriosis has caused, we have seen in our practice that it has caused many miscarriages in patients. And you need to address it, and obviously you need to change your lifestyle. It basically the lifestyle also affects it. So it's not only the medication that is responsible for control of your endometriosis, but your lifestyle changes will also help in it. Friends, if you are liking my infertility videos, please like and subscribe my channel so that I can make more infertility videos for you.